Hello and welcome back to the Advancing Healthcare Innovation Show. I'm your host, Michael Stamatinos. If you're new to us, man, it's so good to see you here. It's good to have you here because we're bringing some incredible conversations with real leaders that are getting some fascinating things done within our space that are actually shaping the future of healthcare. So we're really passionate about a few things. We're passionate about healthcare, leadership, access to care, and adoption of these new innovations. So if it's your first time tuning in, let me just sort of dig in a little bit more and tell you what we're trying to get done here. So we're bringing stories of innovation to life, like real stories. When I say real, I mean folks that are getting stuff done, that are truly innovating within our space, and giving them the platform, giving them the opportunity to sort of share these stories, share the learnings, because obviously you're not always winning all the time when you're innovating, and giving them the opportunity to sort of share that with our community and ultimately with the world. And if you haven't had an opportunity to check out any of the historical interviews, we have some amazing conversations that are coming up. So just make sure wherever you are, just hit the subscribe button now, just so that any of the new conversations that are coming up, they go right to you. So our field, it's constantly evolving. It's our future is happening to us quickly, and we need to have folks that embrace innovation to address a lot of these pressing challenges. And we have no shortage of pressing challenges. So our next guest on the show is one of these leaders that's really getting after it. So I'm really thrilled to have a conversation with Jenna Morgenstern Gaines. She's the co-founder and CEO of Pocket RN, a telenursing platform that connects patients and caregivers with licensed nurses for virtual at-home care. So Jenna's story it's really inspiring. She started Pocket RN in 2020 after seeing her mom's struggles and caring for her aging grandmother from a distance. And we'll dig into that a little bit more and kind of showcase how sometimes when you're going through a struggle, what does that mean to actually inspire someone to create a solution? So we'll dig into that and talk about how she's making quality home healthcare more accessible. So under her leadership, and there's a lot more to come, but Pocket RN has achieved some pretty significant milestones in a short amount of time, including its acceptance into the Centers for Medicare and Medicaid, CMS's innovation centers, guiding an improved dementia experience model, the guide model. And really, this initiative, in layman's terms, it's really aimed to enhance the quality of life for individuals with dementia, to kind of really alleviate a lot of that burden that takes place on caregivers. So, really, kind of giving them a virtual nurse for life at no eligible cost to the members. And we'll talk about how the team has really dug into that. So I'm just so looking forward to this conversation. So just make sure you tune in to Jenna's journey, the growth of Pocket RN, and just her thoughts on the future of telenursing and home healthcare. So Jenna, it's great to see you. Welcome to the show.
Thank you so much, Michael. I'm so glad to be here, and thank you for the gracious intro. You're just somebody who comes to healthcare with such passion and a focus on mission around access to so many individuals. And so I'm just really glad to be here, glad to have a conversation with you, and thank you for everything that you do.
Of course, it's my pleasure. And so maybe we start off just a little bit of sort of the spark. There's usually a lot of things that need to happen in order for someone to really want to take the leap into entrepreneurship. What was that for you? Was there a straw that broke the camel's back, or was it a series of things that happened that said, you know what, I got to take a crack at this? Like, talk me through that.
Yeah, there is, always in hindsight, there's that trigger event or that spark. But I also think that, as you laid out, there really were kind of a series of events and experiences that ended up bringing us to the point where we started Pocket RN. And just personally, in my own world, my background, I worked for many years in Washington, D.C., trying to form public-private partnerships that particularly supported the sandwich generation of women caring for their aging adult parents as well as their young kids. And as
Yeah.
you pointed out, I had seen, my mom go through this, taking care of our grandmother who suffered from dementia, and she had to do so remotely and travel back and forth to care for her and to care for us as kids. And then about 7 or 8 years ago, myself, I actually then started to become a family caregiver to my mom through her healthcare journey. And so, on a personal level, just saw how many times as non-clinician myself, I had to rely on the nurses in our family, in our network, in our neighborhood, our next door neighbor, our friends, to check in on my mom, to help us understand her diagnoses, to answer questions at 11 p.m. on a Friday night. And these nurses were doing this just out of the goodness of their hearts. This is not anything that anyone was being paid for, or anything of that sort. And so when I left my previous work and went to Stanford to get my MBA, I was part of the biodesign program there, which is a program that essentially applies principles of sort of lean startup to healthcare innovation and unmet
Yeah.
medical needs. And I met my co-founder there, Dr. Sam Thomas, who is an internist, but before he had become a doctor, he was actually a CNA, living in the home of a man who needed round-the-clock care. And so both of us were very personally and professionally passionate about trying to help older adults and their families get the care that they really truly needed, where they were, where they wanted it, which was in the home. And then maybe perhaps that sort of precipitating event or spark
Yeah.
or trigger for us was we were in this program and a couple months in, COVID hit. And it became even more difficult for our aging population and for their family caregivers to get the kind of skilled, ongoing, longitudinal, trusted
Right.
care that they needed. And at the
Right.
same time, we saw nurses burning out, leaving the workforce in droves, feeling undervalued, feeling unheard. And we saw a tremendous opportunity to bridge this gap by giving older adults and their families what we call a virtual nurse for life. And in so doing, we were also able to give nurses an opportunity to do what they love and build long-term relationships with patients and families, and do so in a way that was sustainable, for them to practice nursing. And so that's kind of the everything that led up to the ultimate spark that got us to develop the initial concept for Pocket RN.
That's pretty awesome. And I'm just sort of curious. So initially when you go to make that leap, there's always I've seen this. There's a common element, there's a common catalyst, and that catalyst is belief.
Hmm.
Sometimes it's from an individual or a couple of people. Who are those people that initially early on like really believed in you and this concept, and can you maybe shout them out?
I love that. Yeah. So there are so many to highlight, but I'll actually start by saying there was a strong conviction, a strong belief that we developed through doing hundreds and hundreds of quote unquote user research or customer discovery calls with patients, namely older adults, family caregivers, and nurses. So there are hundreds of people that believed in what we were doing that we could potentially that I could thank right now. But there got to be this point after the first 100 conversations, the first 200 conversations, where we all looked at each other and said, "Oh man, we have to build this because we have not only discovered that there is a true need here, but we feel a sense of." Not just conviction, but responsibility, because this is something that people really, really need. And now that we know that, if no, it's like the JFK quote, like if not us, then who, right? Who's going to do this? I don't think that we have, maybe any of us necessarily entered into this thinking that we were necessarily going to start a company, but that's where we landed because we had such strong belief from the people, the end users who would actually benefit from it. And if I were to call out a couple people who were really there for us from the very beginning, our very first advisor, who we met through the Stanford network, Mark Jung, through just their initial 30-minute conversation with him. Somebody who's built multiple companies, taken them from day one through to exit. Just connected with the size of the problem, the personal relationship that he had to the problem, and was one of those very first people that believed in us, that made us feel like, oh man, we have something here, and there are people who have sat in our seat, have been in our shoes before, and have a belief in us. And there's so many others. Andrea Cohen, Nancy Gillette, who's now our chief growth officer. Folks who came from the care at home space and saw this day in, day out, having served 20, 30, 40 years caring for people in the home, running their
Yeah.
own businesses. There are too many to name, but some really great folks that gave us that conviction.
Yeah, sometimes that belief carries you through some downturns. And the telehealth landscape is an interesting one. And I'm just sort of curious how it's evolved, since Pocket RN's inception. What trends have you noticed? What do you see sort of have you had to adopt things as, time has gone by?
Great question, Michael. I think prior to COVID, many of us were strangers to telehealth, and now we
Right.
are use it
Right.
the same way we use Uber, or the same or Lyft, or the same way we use DoorDash. It's become so ubiquitous, and I think a lot of stereotypes that were holding us back have been bashed around telehealth. Just around there's a lot of stereotypes around older adults and their ability to use technology, and we really try to dismantle that at Pocket RN by being creative. I mean, we have something called the zero tech solution, which enables folks to use our platform entirely via text message and get a secure video link at the time of their visit, which makes it super easy, builds confidence, gets people on that video visit that they love.
Yeah.
And so, I think generally there have been some bad apples, and there have been some bad situations and circumstances through telehealth, but there's been sort of just a tidal wave of acceptance and adoption that has been positive if you make sure that you are maintaining quality as you scale. And so we've seen that sort of tidal wave. There's something that we like to talk about a lot at Pocket RN, which I think helps people understand how we are different from what they might
Yeah.
see more broadly in the telehealth space. And we say that peace of mind equals trust plus knowledge plus access. And before I kind of explain what that
Yeah.
means, I pose a question back to you, Michael, which is if you are feeling, just to maybe illustrate this,
Yeah.
if you think you might be experiencing, or your loved one might be getting sick, or there's something not quite right or wrong, or you think you might be having some healthcare issue, or there's some new diagnosis in your family, who do you call? Who's the person that you call, and why? And there's no wrong answer. But I love asking this question because I think it illustrates the equation. So who do you call?
So for me, I'm very fortunate where, having been in healthcare for 20 years, dating myself here, but my Rolodex is pretty deep. So if I need to call a physician for something, I call a physician for something. Folks that for example, like a really close friend of mine is a physician, and we played soccer together. So it's like if I have any clinical questions, I'll text Anthony and say, "Hey, got a quick question for you. Like, do you mind, chatting real quick?" So literally, I have that type of access, and it's great. Outside of that, I always think about like my family members when something happens. Who do they reach out to? They reach out to me. It's not like what. They don't try to figure out like how. What they try to do is they say, who? Who do I know? Who do I know? How do I get access to that?
Those are both perfect answers. And let me explain why and how it kind of illustrates this equation. And just to reciprocate, I'll tell you who I call. And
Yes.
people call me too, right? Even though I'm not a clinician, and I'll explain why. But I call Sam. I call my co-founder. He's, why do I call Sam? Same reason that you call your friend, right? Who's a physician. Number one, and this is maybe the most important part of the equation, we trust them. We have
Totally.
probably played soccer with your friend,
Yeah.
right? Sam and I are building a company together. Like, there's no real deeper trust than that. Number two, they have the relevant knowledge that we need, right? Your friend is a physician, Sam is a physician. They have that, right? And you have access to them. You can text your friend and he's going to text you back, right? I have access to Sam. I can text him. He's going to call me right back, right? those are that's a magical equation. And the reason your family calls you, right, is because they trust you, they have access to you, and they know you might have a little bit of knowledge, or at least enough to get you to the next to
Yeah.
get them to the next rung, right? And so those three elements are really what we are trying to recreate with that nurse for life relationship. And what is so different about that is, anyone could go on a teledoc or a doctor on demand today, and they could get in touch with a licensed physician who they have access to, maybe not within minutes, maybe within hours. But why don't they do that, or why wouldn't you do that? It's because it's a random stranger, and you don't trust them. You don't have a relationship with them. And so what we see in a lot of in sort of across the telehealth space, and by the way, those solutions serve very important purposes,
Yeah.
and ours is a different purpose. But what we have that we don't see others have as much of is that trust, in addition to that knowledge and that access on an ongoing basis. So, to long way, drawn out way of answering your question about sort of telehealth, but I think it's something that we are it's a space that we play in, but we see ourselves as very different to a lot of the other folks that are out there.
Super fascinating. And I just remember in one of our previous conversations, which I kind of drew upon for this conversation, is you talked about the ability to be flexible and nimble and how the team was able to innovate within constraints. So, for example,
Mhm.
like your business model and how you landed on the opportunity with the guide model. Can you maybe share a little bit of that evolution? Because it's one thing to know these principles, which is like, hey, be available, be consistent to be able to provide access. Great. Who wouldn't want that? Of course. Don't make it transactional, make it relational. But how do you take that and put it into a scalable business model? So talk about like that evolution, how you landed on the guide model participation.
Yeah, great question. And in sort of hindsight, it's easy to draw sort of a straight line, but I won't profess to say that we kind of had it all figured out from the get-go. We had to learn
Right.
learn a lot by doing. But I think the best way to kind of answer your question, Michael, is by sort of walking you through our journey. And at the very beginning, when we started Pocket RN, we knew that we were creating a value-based care solution, and we validated that through a clinical trial at Stanford Healthcare. At the same time, there wasn't an obvious way for us to start off by working with the kind of gold star payer that we thought would accrue the most benefit from
Right.
this value-based care solution, which is Medicare. And we knew that we were going to have to work our way up to that North Star to be able to get there. And so we actually started by selling into providers across the healthcare continuum. So we continue to work with health systems, home care providers, senior living facilities, FQHCs, like really diverse set of partners in healthcare. But they all have something in common, which is that they are all truly incentivized within their own business, for one reason or the other, to actually keep patients healthy and as independent as possible at home for as long as possible. Now, there
Yeah.
are some entities in healthcare that their incentives are the opposite. Their incentives are to see you for a certain period of time in the hospital and then to not follow you after that or before that. And that's fine. That serves a purpose. But all of our partners had some true incentive and intrinsic motivation to keep their patients healthy at home for as long as possible. And in so doing, we were able to actually make a pretty compelling business case to
Right.
them to say, all right, we're going to help you improve those outcomes. And so the providers would pay us in order to serve their patient population. And usually we found that there was over time, we found there was some long-term cost savings to working with Pocket RN, but also some short-term revenue generation opportunities. So some of
Right.
our partners were able to start reimbursing for our services on the back end, using different sets of existing CPT codes that just maybe hadn't been quite used this way in the past. And so as we worked together, we started to learn that actually we, Pocket RN, could be a Medicare provider ourselves. And so we became a Medicare Part B provider, and we applied to the guide program, which I'll share a little bit more about, kind of all around the same time, which allowed us really to get to that North Star for us, which is to serve Medicare directly, and as a business, and in order to be able to scale, it gave us a way to essentially get full federal funding for the care
Right.
delivery model that we built. And when we read the application for Guide, which, as you so articulately described, is an innovative dementia care program for patients and especially for their family caregivers. It read like a description of Pocket RN, and so we were like, this is perfect for us. This is a way to do exactly what we've been doing, to get paid by the federal government and demonstrate the power of what we're doing in the long run, the cost savings, and the ability to improve quality of care, and to do so with the existing partners we're working with without them having to pay for Pocket RN anymore. So it really was kind of this light bulb win-win-win moment that we never could have predicted. But all of the trends were kind of moving in the right direction for a program like this to emerge, and we were ready at the time that it came. So that's
That's
kind of our journey.
that's fantastic. And listen, because you guys are opening up all this access, I'm just wondering, are there any patient stories that you can highlight that you share with your team,
Yeah.
with just things that continue to inspire the team?
Yeah.
Uh, we'd love to sort of just hear what some of those really positive outcomes have been.
Yeah, there are so many, and I'll just share the one that's come up most recently, because there was another one that came up yesterday that was pretty touching. We have a patient who is really complex. This patient has not only some of the more challenging chronic conditions like diabetes, COPD, CHF. They also have a lot of behavioral health challenges, anxiety, depression,
Mhm.
and we've been working with this patient now for over 2 years, and this
Oh,
patient has a really amazing relationship with their nurse for life. A shout out to Kelly on our team, who's one of our amazing nurses. They've built a tremendous relationship where we have actually continued to serve this patient even past the time that the official program that they were part of with this particular partner ended. And we now are able to serve this patient on an ongoing basis. And now that we're an actual provider ourselves, it gives us the opportunity to just serve them directly, build directly, and be able to provide continuity for them. And they did not know that the sort of official program that was sort of covering the cost for us helping them was going away, or had gone away, and that we were continuing to serve them, even though that program had sort of ceased to exist. And the individual sort of started crying in the meeting with her nurse for life, and said, this is the first time that I felt like someone has put me first. And that was something that really hit home, I think, for us, because so many patients get lost in the system. The program goes away, or they change doctors, and there's no continuity, there's no glue, there's no sort of person that's in your corner, following you, working with you, partnering with you for the rest of the journey. And that's what we want to be, throughout the
yeah.
rest of our patients' lives. And so for her to say that, not to mention all the other clinical outcomes that we see, from her, because those things are tied together. When you feel cared for, you invest more in your health. She lost 20 plus pounds, like all sorts of things that, I don't think happen unless you actually have a real relationship with someone that keeps you
And
motivated and engaged.
and what's the cadence? Is this like a daily interaction? Is it like, can
Question.
you describe that? Because
Yeah.
I think about nurses in a traditional clinical setting,
Yeah.
and sometimes it's intermittent. I'm just sort of curious as to what the cadence is.
It's a great question in this within this example, even because at the outset, the communication was pretty frequent with this individual. It was every other week roughly, and then even at the beginning, it was even more frequent than that, because there were a
Yeah.
lot of sort of reactive behavioral health needs in particular that we were attending to at the outset. And one of the interesting elements of this nurse for life model is that as we build trust over time. And help instill that sort of intrinsic internal motivation in our patients to, take back control of their health and of their care. We actually are able to reduce the frequency of the number of interactions that the nurses have with patients over time, and allow them to be even restore independence in their lives. So while this started out as an every other week cadence, it actually now is a once a month cadence. And this was not just this actually wasn't a commercial or a financial decision. It was a decision by our nurses who said, I think it's really, we've been working together for a long time. I think that you can be okay seeing me once a month, and let's try it out, and let's see how you do, and let's see if you're able to feel still in control, and like you're able to take care of yourself. And it's worked. It's worked really well. We see that with a lot of patients too, that they start with sort of a heavy reliance, but we don't want to be a crutch. We want to be the one that
Right,
empowers you to be
right,
able to
right.
take some control back. So that in the context of this example, it's actually a very interesting question, and we see it a lot as a trend across all of our patients.
And you mentioned something earlier about workforce, which has really intrigued me, which is when you get a nurse that comes from a traditional setting, what's
Mm.
the timeline for them to be able to just make the transition, knowing that they are virtual, they're not like walking
Yeah.
into a patient room? Like, what is the training like? I'm just sort of curious.
I love that question because I think a lot of people think about telehealth, right? And this is kind of true in the case of doctors, where you can kind of throw them on a Zoom, and they'll do their thing. And there's not
Right.
as, I don't want to say there's no transition, but there's not a huge transition. We are the way that we've had to build our company has involved building so much training, so many resources,
Yeah.
processes, protocols, because as you know, Michael, it's not a one-to-one transition, especially for a nurse who's been working on the hospital floor. It's very different. And so that's something that we built that has become, in many ways, kind of a unique capability of ours. And, we obviously have formal onboarding and training, and that takes about a week of time or so for a nurse to get onboarded and ready to go and start seeing patients and doing some shadowing maybe at first. But what nurses have been telling us is that it usually takes them 3, 4, sometimes 6 weeks before it really clicks, and before
Yeah.
they've been what we call disoriented from the healthcare system, because they are really used to having to run things by other people, or not knowing if they can, practice to the full extent of their scope, and not having the empowerment to really be a leader in a patient's care versus just a member of a care team. And so it takes them a few weeks before things really click, and they really realize, oh, this is very different, and it's special and unique, and I like it, and I get it now. And so it does. You're right to kind of observe that it can take a little bit of time before that kind of light bulb goes off.
And then do they also, in the same token, act as sort of a case manager? Let's just say something needs to be escalated. You mentioned Sam as the co-founder, so clearly, is he the medical director? I mean, is there,
Yes.
or a
Yeah.
CMO? How do you balance all of that out between I'll just call it a multidisciplinary team?
Yeah, great question. And that's exactly right. So he is our medical director. He has other providers that are under him, but he is ultimately the one that provides the oversight and supervision for our entire workforce. And so if there is an issue, for instance, nurse wants a second opinion, or they want, and sometimes they'll go laterally, they'll go to another nurse who's specialized
Right.
before they go up. But let's say, they think a patient needs change to their prescription or some sort of diagnosis, they can escalate to Sam or to another provider who can help them with that. And sometimes it's just because there's an issue that's escalated. Like we've had times when we've just had sort of a difficult to work with family caregiver, and so our nurses will say, I could really use a little bit of backup, and they'll escalate up to Sam so that they can bring in another doctor, a member of the care team in to help facilitate. And the interesting thing is, we need that. It's fantastic that we have this
Yeah.
supervisory layer, this oversight layer, the ability to really flex all the way up to the very top of a medical scope of practice. It happens less than 5% of the time. Less than 5% of the time is there any kind of escalation to a provider beyond the nurse. And I think we're finding that the nurses can do a lot. Doesn't mean that we shouldn't have this structure in place. We need it, we want it, and we want to be able to fulfill 100% of the needs. But it happens a lot less than we even thought when we started out.
I know we're kind of getting towards the end of our time here, but I just want to think about you as the leader of the company. How far out are you looking? And then give us a glimpse as to what you believe that future looks like for Park at RN.
Yeah, it's a great question. And, I shouting out to one of our initial, our very first advisor, who was our board chair now, Mark Jones, who said, to me in early days, Jenna, you're going to be thinking 2 to 3 years out. You want your executive team thinking a year out, and you want their reports thinking quarters out or months out.
Yeah.
And me as the board chair, I'm going to be thinking about 5 to 10 years out and making sure that you are making decisions today that are going to impact you positively as time goes on. And so I always thought that was very helpful, a very helpful framework for me. But at the same time, I'm thinking, and a startup is a startup, right? I'm thinking about tomorrow as much as I'm thinking about 10 years from now, right?
Yeah, yeah, yeah. Just being
I
honest, right? You're being honest.
exactly. Exactly, yes. I'm radically, transparent about it. And, but what excites me is really thinking about that vision 5 to 10 years out when, we imagine and hope that everyone who could need it could have access to a nurse in their pocket. And the beauty of that is that it allows us to really feel unsatisfied on a day-to-day basis until we feel like we've gotten there. And I think
Mm.
that there's something in a lot of founders that sort of it's a dissatisfaction that even when things go well, they could be better, and there could be more people that benefit, and we could get out to everybody who could possibly need us, and that's a pretty powerful motivator because you don't settle, and I do think that that's something that I'm grateful that we have that mission that's so motivating and driving for us.
That's right. So how can folks continue to follow your work, the work of Pocket RN? Maybe just sort of give a little commercial before we wrap.
Yeah, absolutely. I mean, please feel free to reach out to me at any given time. My email is very simple. It's jenna@pocket.com. And feel free to reach out, via our contact us page, or just follow us on LinkedIn and on social media. And we like to keep that updated. If anybody's interested in partnering, particularly around the guide dementia care model, please do reach out to us, at contact@pocketrn.com. And we're always excited to chat with folks who are part of the program or who are looking to be part of it in some way. So thank you, Michael, and just
Yeah, of
we
course.
really appreciate this opportunity.
I think one thing that struck me from our conversation today is that you guys aren't a startup. You're a company. You're a real company that has real patients, that cares. You are delivering care. You're doing it in a very efficient way, leveraging technology. Like, make no mistake, you're a caring company. And
No,
that's really cool to see. Like,
yeah,
honestly, it really is.
I
So for
appreciate it.
those that have tuned in today, and if you happen to find this conversation inspiring, or maybe it was a little bit of the belief that you needed to start your journey, let us know. Put it in the comments. Let us know what you thought was interesting. And if you wouldn't mind, please share it on your social channels. So, Jenna, great to see you. Look forward to our next conversation.
Likewise, Michael. I really, really appreciate it. Thank you for everything that you do for our community. I really appreciate it.
You bet.